Good morning, everyone. It's really an honor and privilege to be joined by Professor Kevin Fenton, President of the Faculty of Public Health, and he has done recently an editorial for the Journal of Public Health, and we'll be having a quick chat with Kevin around the editorial piece, as well as his term of presidency, which will end soon. And I think before we start, can I just say thank you to Kevin on behalf of the faculty staff, all the Journal of Public Health editorial team, as well as the staff and the wider public health workforce, both in the UK and internationally. So thank you, Kevin, for really exemplary and visionary leadership over the last 3 years. And over to you, Kevin, if you want to start any introductory words.
Well, wonderful. Thank you so much, Sam, and hello, everyone. And Sam, thank you. It's a wonderful privilege to be able to have a few minutes to have a chance with you to reflect on the last 3 years as a faculty president, and more importantly, on the recent article which I'm publishing in the journal, which I think is distilling a lot of the learning over the last 3 years. Pulling together a lot of insights and perspectives from members who are thinking critically about the challenges that we are currently facing, and more importantly, how do we protect ourselves? How do we be more resilient for what's to come? And if I think about the key themes that have run throughout my presidency, it's been one of service to our members. It's been a theme of leadership of all types, visible leadership, compassionate leadership, and transformative leadership. And it's been a theme of being operationally efficient and effective. And I'm looking forward to our conversation today. And most importantly, what's to come for the Faculty of Public Health.
Thank you. Thank you very much. That's really a timely piece as well you put in the editorial. And we have got a few questions related to that. I think to start with, in your piece, reflect we are facing increasingly complex times as an international public health community, with global public health programs and principles under threat. As public health professionals, Kevin, how might we respond to this shifting landscape?
I think there are three things which are really important here, Sam. The first of all is recognizing that this is the new normal. And because it is a new normal, we need to be present. We need to be using all our skills and our faculties to do the horizon scanning, to do the sense making, to understand the nature, shape, and form of this complexity so that we can understand where best to place ourselves, where to place our teams or partnerships to be able to respond. And the nature of these threats are multiple and varied. We're discussing rising tide in non-communicable diseases, changing patterns in infectious diseases, the emergence of antimicrobial resistance, the challenges of a workforce that is often underpaid, disengaged, and fatigued, really thinking about the geopolitical changes which are happening and how that has a massive impact on economies, on security, on the ways in which we work with trusted partners, and how we deal with global issues, which are likely to have an import on domestic issues as well. I think, Sam, it is in this space that we need public health practitioners to be able to understand the external environment and to understand where best to intervene. There's a second thing which I think is necessary, which is understanding the kinds of leadership which is required at this stage. We need to be more agile. We need to be able to work in stronger partnerships and coalitions in order to build organizational and system resilience. We need to be able to assess and synthesize data coming in from multiple inputs to be able to sense make of the environment and where best to use our efforts. And finally, as public health people, we need to stick and stay close to what makes us different and unique. The fact that we're able to bridge evidence and understand data and to understand how we think about evidence-informed policies and programs, which we then evaluate for impact, really puts us in good stead to say, with all of the threats coming in, here's how we can approach it as public health practitioners practitioners. Here's the skills that we bring, whether it is in coalition building, engaging communities, whether it's thinking about modeling the impacts of these changes, to be able to be better partners for policymakers and decision makers. So that third aspect is staying true to our core skills as public health people in this chaotic world that we're living in. So those are things, Sam, that I've been thinking about, that I write about in the paper, about navigating this period. Let's not run away from it. Let's lean into it, but lean into it using our core capacities and capabilities as public health people.
Yeah, it's interesting you mentioned data, science, and technology. As you also highlighted the impact of modern technology on public health, including the misinformation and disinformation online, particularly the rolling back of fact-checking policy by some major technology companies. I think looking to the future, how do you think evolving technologies such as artificial intelligence might impact our health, and how can we harness these technologies in our work?
Yes, well, let me be absolutely clear, Sam. I love technology, right? So I have always been interested in understanding new diagnostic technologies and how that can help us to go further. We do a lot of work in partnership with our pharmaceutical companies because we're thinking about new vaccines, new drugs that can help us to both treat conditions better, but also in an area where drugs are a key part of the preventative agenda. So whether it is preventing obesity, whether it's preventing HIV transmission, we need to look at new technologies. And clearly with the advent of AI and how that's revolutionizing how we access information, how we process information, how information is presented to us within whatever settings, it behooves us as public health people to understand how technology is evolving and to be among all of the medical specialties which are at the forefront of this. We cannot be caught sleeping while given the pace and scale of technological change. But what we must do is understand that not everything that shines means that we need to be running after it. We need to again use our public health skills to understand the overarching emerging trends, to be able to bring to the table the evidence on how those new technologies are working, and where that evidence doesn't exist, to advocate for the evidence to be built. We need to be exploring the intended and unintended consequences of these technologies and this impacts on different communities and different people across the life course. Because we know that technologies, for example, will have different impacts on young children, developing adolescents as they would with adults, especially when it comes to screen time and the kinds of information that people are needing to process. We also need to think about these new technologies in an era of the unequal distribution of digital technologies and tools, so that we're not leaving communities behind. And I think public health has a critical role to play in the issues related to digital equity, looking at the cultural competence of the new tools and technologies that are being developed, and to ensure that we all stand to benefit from new technologies and different communities aren't being left behind. And finally, what I'm really keen to see is that we have and develop far more systematic research programs that public health researchers and public health academics working with practitioners are beginning to develop what is our research strategy when it comes to understanding and implementing new technologies. How do we assess their impacts both at the individual and the community levels? How do we develop advocacy platforms that says, actually, as we're using these technologies, here are the safeguards and the guardrails that we need to have in place to secure individuals' physical and mental health. And then finally, because so much of technology is promising so much of a better future, but does it really? And who is being left behind? And what are some of the costs we're paying for these technologies? So again, I think there's a really big public health research agenda in this. I think it's underexploited and underexplored. And I'd like to see way more articles in the journal talking about technology and its impacts on population health, both benefits and the costs.
Thank you, Kevin. I think it's really important you highlighted both the drawbacks as well as the benefits and trying to get the balance right, which is quite important. Coming out from those kind of editorial questions, can I come back to the UK? And we have seen some concerning kind of trends in recent years, particularly around life expectancy stalling, and even going in the reverse in some of our most deprived areas. how can we build capacity and capability of the future public health workforce in the UK, given the current political and economic climate?
Yeah, really important. I think, at all times, right? We always have to think about the unique role that public health practitioners play within our society, and to be both the practitioners who are the conscience of health and care systems and society, being able to look at evidence to inform policies to improve health, reduce inequalities, and to save lives. And now more than ever, when, as you say, the demographic shifts that we're seeing, the rising poverty that we're seeing, the rising tide of NCDs, the pressures on the NHS, means that now more than ever, we need a strong, confident, robust public health workforce that can help local government to commission better, that helps the NHS to commission better, provide high quality clinical care, and that can help government to focus on the policies that are needed. There are three things that we've been doing in our journey over the past 3 years in the faculty, which I think are critical, Sam. First is to ensure that the existing cadre of public health people are well trained, that are connected to the Faculty of Public Health, that we create a membership organization which is admired, respected, and understands its members and is supporting their members across their career life course. That's important because we are stronger together as public health people. And if there's one hope I have as I step down from the presidency, is that all of the things we've done over the last 3 years to create a stronger public health community will be taken forward, because that is what is going to help us to withstand some of these challenges. The second thing is ensuring that we have the right capabilities in the right places to make important decisions. In England, we're now beginning to see the emergence of neighborhood NHS service, the importance of place-based services, and new ICBs, new regions. We have to be in the rooms where the core capabilities and the needs for public health input are being discussed. And we need to ensure as practitioners that we skill up or practitioners to be able to slot in and fit into different parts of the system to continue to provide the value add that we know that we bring to discussions. And then finally, I think we need to continue to keep a close eye on all nations of the United Kingdom, because health is evolved, and therefore there are always new models of best and promising practice emerging in the different nations. And I don't think we do enough to connect with each other, to learn about what's working, and to share best and promising practice. So I would like to see more of that as I step down from the presidency. We've set up lots of things that bring people together, or distinguished lectures, or spaces events, the work of our local board members, collaborating in place with ADPH and other public health bodies. All of this is to ensure that we're working together, sharing best and promising practices, and building that resilience to be able to be more effective in the face of change.
Thank you, Ken. That's really, really important point. And finally, as your term of presidency of the faculty is drawing into a close, could you offer some reflections on the past 3 years and what it means to be a leader in public health?
Sam, that's a great question. You can imagine, after 3 years of doing the faculty presidency job, a busy job as the director in London, and many other things that I'm privileged to lead, it is an emotional time, right? Because I've always said, and I said this in my first speech, that I don't take this for granted. Leadership is a privilege. And leadership is also a craft. And every day, Sam, I have learned something new. I've reflected on what went right, what I'm proud of, but also times what didn't go as well as I had hoped, and what I learned about that. And I've approached the job with deep humility, recognizing that at any given time, it is the trust and the support of our members, and the realization that the faculty is providing a value add to the lives and careers and effectiveness of our members that have driven me forward. I've taken such inspiration from listening to and working with our specialty registrars or resident practitioners, because they're the next generation in public health. And I'm so proud of what they're doing. Recently attended their conference and just have been inspired by their energy, enthusiasm, and their focus on creating a better world through public health. But I've also been inspired by many partnerships that we've really used over the last 3 years, and the new relationships and partnerships we've developed. I'm also inspired by the strong relationships that we have with our colleagues working in the various governments, in public health agencies. And I'm particularly proud of the ways in which we have been visible leaders for public health, whether through our lectures or website or digital presence, telling our stories and sharing our stories to members. And finally, I'm proud of the fact that we advocated and where voices were heard, whether on poverty, whether on the changes in the NHS, whether on global conflicts, whether on the things that matter in tackling structural racism and creating fair training opportunities for our members, and whether it is on the things that matter to all of us to help us to do public health better. It's been wonderful to be able to advocate on that. So Sam, I am happy to stand down and finish my 3 years, but I'm doing so with a deep sense of gratitude, a humility, and a joy to have been able to serve in this way.
We will miss your presence greatly. I'm sure this is shared by all the faculty members. So thank you, Kevin. Thank you very much.
Thank you so much,
Great
Sam,
time.
and all the very best with the journal.
Thank you.